Being in the military can be a very dangerous job. We are asked to do things that are crazy that you wouldn't do if you had the choice. And there are health consequences, some immediate and way too many long-term, as I think we're beginning to understand now. In fact, one of the reasons that I got involved in MVP and research studies is because, we need to understand what are these long-term effects.
So what makes MVP unlike any other research program in the world? I would have to say, first thing is veterans. The veteran population, the unique experiences they've had during their military service, were able to only study because this cohort is embedded within the VA. The second is the very deep and comprehensive electronic medical record we have on all our participants.
The amount of data that we've generated from their samples, but importantly, the data that's associated with their electronic health record has been utilized by hundreds of investigators across the country. So there's been incredible growth in terms of the size of the amount of data, as well as the different types of investigations that have been ongoing.
So what it's allowed us to do is do some of the largest studies, genetic studies, in so many different areas: PTSD, lipids, anxiety, heart disease. The largest studies that have ever been done have been possible because of this.
The medical records that are feeding the MVP program are the same medical records that clinicians are using to understand and get recommendations for what they might do for veterans. When we create a model or an algorithm or a tool that helps us do something in the MVP data, we are able to take that and move it very, very quickly into clinical care because all the infrastructure and systems are there already.
Now that MVP has surpassed the 1 million mark in terms of enrollees, we now have this critical mass of data where we can actually start translating that into clinical care, be it clinical trials, the way we take care of individual veterans. So one study that we led, the MVP Return of Actionable Results study, was a pilot study to start to reintroduce some of this genetic information, specifically related to high cholesterol, back to a very small number of participants and their providers, and study the process of doing that.
Once we had results back, I gave those veterans a call to tell them their result, and we shared that with them and their primary care providers so that they can make clinical decisions based on it.
So the PROGRESS study is also using MVP data, this time to improve the way we screen for prostate cancer in veterans.
The PROGRESS trial is a national randomized controlled trial across the VA here, and the idea here is men who have a higher risk to develop prostate cancer might have more frequent or earlier screenings compared to men at average or low risk.
I'm in this prostate cancer screening study, and what I hope it can do is I hope it can improve the outcomes of screening for veterans and for men at large. And I think that's, great promise for catching cancer early.
Once I found out my predisposition to prostate cancer, one of the first phone calls I made was to my son. I have given him a copy of my study so that he can bring that to his healthcare provider to try to, so that he can advocate for himself.
I think what this program offers is our ability to move way upstream before people develop diseases, to keep people healthy for longer and live a more fulfilling life.
We're just starting to embark upon moving research into clinical care. One of the exciting areas that we're looking to is pharmacogenomics.
We're very interested in using MVP data to identify, are there any differences or what are the differences in our DNA that can predict how patients might respond differently to their medicines.
And because of what we have done in MVP, we can then make sure that the veteran gets the most appropriate drug as the first line of drug. This allows us to more personalize the care that is provided in the clinic.
The thing that excites me the most is about the future. And I feel like that is now the next step of this book that we're writing, is to not just make discoveries, but to take those discoveries and turn them into action so that patients actually live better and healthier lives.
The Million Veteran Program is particularly powerful, one, because of its size, but also in terms of its diversity in the population that are part of MVP.
We want to continue to diversify the cohort. We want more women, we want more underserved populations, we want rural veterans, we want younger veterans, because we want to keep the cohort vibrant so that we are poised to be able to address any and all health issues, regardless of the group that it afflicts.
When veterans enroll in MVP, they're helping not only themselves, but future generations of veterans and future generations within their own family. And so by joining, they're having such a broad impact beyond just their own healthcare.
I think it's important for all veterans to consider joining. The larger the group of people that are in the study, the more details we can find. So I would encourage all veterans to join.